Let's talk about water birth and or water labor in a hospital setting. First of all, why would anyone want to do this? Essentially, it does help with labor pain. Think about it. When you're in water, you're more buoyant and you can move more freely. I could do a whole series on this. Typically, you have to have a low-risk pregnancy to do this, meaning minimal to no complications in your pregnancy. Before getting in the tub, the patient has to be assessed and the baby has to be monitored to make sure that everything is okay. Hook them up with a bunch of towels because it can get very messy. I can do cervical exams while they're in the tub, put a sterile glove on top of an arm-length glove in an attempt to not get any bodily fluids on my skin. Speaking of, we collect any floaters with a gloved hand or net. We do intermittent monitoring on the baby. This is a waterproof Doppler that I use. No gel needed if it's submerged underwater. And I always keep the patient hydrated and fed, because labor is a lot of work and you burn a lot of calories. People always ask, how does the baby not drown when it first comes out? Well, newborns have something called a diving reflex, the natural reflex where they won't breathe until their face hits the air. We bring the baby to the surface as soon as possible. The provider should educate you on the risks and benefits of water birth and or labor. Again, I could do a whole series on this. Let me know if you want more information. Until then, hope you learned something.